Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response efforts. Joining me again is interpreter Francis Beaurivage, and thank you so much, Francis, for being here to provide your services. And thank you to the media and to all of our residents for tuning in to learn more about how you can protect yourself and your loved ones and our community. We want to remind everyone to please visit our website, covid19.lincoln.ne.gov, where you can continue to access additional updates and resources to help navigate these times. The website includes a data dashboard that is updated each day about the time of this briefing, and you can learn more about our local cases and investigations of them by visiting that dashboard. The website also features our COVID-19 risk dial, a simple tool that's been designed to help everyone know what actions and behaviors they can take to protect themselves and others during the pandemic. The COVID risk dial provides a visual, color-coded depiction of local conditions for all of us here in Lincoln and Lancaster County. It's essentially a forecast of risk. And because the risk of spread of COVID-19 in our community remains high, the dial is orange and continues to come with the following recommended guidance for all of us here. Stay home as much as possible, and definitely stay home if you are sick. Keep 6 feet of distance between yourself and others. For those over the age of 2, wear a face covering when outside the home. And continue to wash your hands frequently with soap and water and routinely disinfect high-touch surfaces. We update the dial every Friday, so that will be part of our briefing tomorrow. Here in Lincoln today, we have had an additional 49 individuals test positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stands at 967. Our total recoveries identified to date are up from 131 to 134 individuals. And an individual is deemed to have been recovered from the virus 28 days after they tested positive for COVID-19 and have been confirmed to be symptom-free. Here to provide more details on the Health Department investigations of our cases is Interim Health Director Pat Lopez.
Thank you, Mayor. Yesterday, Bryan Health and CHI St. Elizabeth were reporting more testing, with 312 tests completed compared to 240 on Tuesday. Excuse me. The sites are able to conduct 300 to 500 tests per day, so tests are available for those who show symptoms of COVID-19. To get started, you fill out a risk assessment at chihealth.com or bryanhealth.com or testnebraska.com. Even as elective surgeries have been slowly ramping up over the past 2 weeks, our hospital capacity in Lincoln remains healthy. This factor takes into account the total number of patients, the total number of COVID-19 positive patients, and the number of intensive care unit beds that are available. The number of local hospitalizations of COVID-19 patients is up from 37 yesterday to 40 today. That includes 24 from Lancaster County and 16 from other parts of the state. The number of patients on ventilators is now 12, which represents 7 from Lancaster County and 5 from other parts of the state. Our Lancaster County positivity rate is up slightly from 8.2% yesterday to 8.4%. The state rate is back up from 15% yesterday to 15.2% today, and the national rate remains at 15.7%. Our investigations into the outbreak in Crete and the smaller clusters at our local food plants have identified more cases. The total number of Lancaster County cases connected to the Smithfield plant in Crete has risen from 285 Tuesday to 292 today. 170 of those are employees at the plant, and 122 are family members or other direct contacts. The number of local cases related to the Smart Chicken plant in Waverly is up from 15 Tuesday to 20 today. That includes 13 employees and 13 close contacts. We continue to work with these facilities to provide assistance to mitigate further spread and to complete more testing. The number of positive cases related to the Smithfield plant in Lincoln remains at 20 today.
Thank you, Director Lopez. And before we turn to today's topic, which are the directed health measures for the month of June, We want to acknowledge that there are many people and organizations in our community that are providing healthcare and public health-related services, from our hospitals to our pharmacies, from our long-term care facilities to our home health aides, and from our epidemiologists to our therapists. We owe a debt of gratitude to a huge range of service providers in our health space, both public and private. We are fortunate to be joined today by a critical partner in this space, our local blood bank. Earlier this month, the Nebraska Community Blood Bank issued an urgent call for blood donors, with the local blood supply being dangerously low. And joining us by Zoom to address this need is Erica Busta, the Marketing and Community Relations Specialist for the Nebraska Community Blood Bank. Erica, over to you.
Thanks so much for having me, and we appreciate you sharing this need with our community. As we approach Memorial Day weekend, we normally see a drop in blood donations, but we really hope that we can have more people in our community come out and donate and support our local hospitals. Right now, our supply is at about a 4-day supply, and we'd like to get it to be a 7-day supply. And that is just an ideal way to support our hospitals as we do see those elective surgeries ramping up, and just to make sure that there's always blood available when patients in our community need that blood. We need all blood types, so if you aren't sure what your blood type might be, if you've never donated blood, we would love to have you come and donate. We do encourage donors to make appointments. That helps us to have social distancing measures in place and keep staff and donors safe. We also really want donors to wear a mask. If they don't have a mask, we can provide them as long as supplies last. We're also taking a lot of other different safety measures, including temperature checks at the front door and rigorous cleaning practices between every donor, as well as spacing out appointments more than they normally would be. Part of the reason for our low supply is because we've had to cancel nearly 200 blood drives since March. And blood drives make up nearly 50% of the blood supply in our region. So we really want to see donors come out to our local blood donation sites. And we have 3 in Lincoln and 1 in Omaha. So there's lots of good opportunities to donate. And as the month of June begins, we are looking to restart those blood drives in the community with all the safety measures in place as well. We want to make sure that the public knows that donating blood is safe and essential for taking care of people in our community. And in terms of eligibility, as always, you're only eligible to donate blood if you are feeling healthy and well that day. We want to make sure that all donors are aware that we don't want anyone in our building who might have any symptoms or temperature, anything like that. So we want people to be extra vigilant for those symptoms before they come and donate blood. All our other eligibility questions are in place. So you need to be at least 17 years old or 16 with a parent permission form, 110 pounds. We have a series of other eligibility information on our website, so you can check on those. And if you aren't sure whether you're eligible, if you're taking a medication or just have a question, you can feel free to call us and one of our nurses can answer those questions for you. And the best way to sign up to donate is to call us. It's 402-486-9414. And we encourage you to make those appointments once again. Another great thing that we're doing to help combat the coronavirus in our community is to collect convalescent plasma. And so if you are a recovered patient with a positive test result for COVID-19, we encourage you to go to our website. There's a spot right on the homepage where you can fill in a short questionnaire about your coronavirus symptoms, to upload your test result, and then one of our staff members can help you to sign up to donate convalescent plasma. And that would allow you to help someone who's currently hospitalized with coronavirus, because the antibodies in your plasma that your body used to fight off COVID-19 can help a patient in the hospital in our community. We've already seen great results for helping patients locally with plasma that we've helped to supply from other parts of the country. And we want to see us build a larger donor base of people here in Lincoln.
Well, thank you so much.
That's all on our website. Yeah, thank you.
Thank you so much, Erica. We really appreciate your work, and we look forward to talking to you more about convalescent plasma donations, and other interested community members who've reached out to us and helping to support that effort. We really want to emphasize that donating blood is giving the gift of life. If you are healthy and able to donate, again, that number you can call is 402-486-9414, or again, you can visit the Blood Bank's website at ncbb.org. Today, we acknowledge the changes made to the statewide directed health measure, or DHM, announced by the governor this afternoon. Our expert staff at the Lincoln-Lancaster County Health Department have been consulting with state officials to provide input on these health measures applicable to most of the state effective June 1st. As previously noted, our health team evaluates a number of factors that guide our decision-making regarding directed health measures. Chief among them are trends in our caseload, the positivity rate or percentage of positive tests, the capacity of our hospitals in terms of beds, ventilators, and PPE, the availability of testing, and our public health capacity to do and perform contact tracing. With regard to trends in our cases and positivity rate, Lincoln has not seen a spike in cases. On this note, we would remind everyone that the large one-day caseload earlier in the week was due to a backlog in receiving test results from private labs. We've seen a declining positivity rate week over week. Last week, our average positivity rate was 9.42%, and this week that rate is down to 8.3%. Our hospital capacity and contact tracing ability are very good. With regard to testing availability, we are very pleased with the growth in the availability of tests. We do want to acknowledge that we remain concerned about the turnaround time for results from private labs. That timing is crucial to our ability to perform contact tracing effectively. And while this issue is being resolved by the private labs, we continue to implore people to quarantine until they receive their test results. With the analysis of these factors in mind, as well as our interest in alignment as much as possible with the state to provide consistency for our residents that helps them to be clear about how to be safe during this pandemic, our local DHM will be updated to align with the state health measures on June 1st. This means that the vast majority of businesses will be allowed to operate with a 50% restriction on occupancy, including bars, which will be allowed to open under the new DHM. Gathering restrictions will be adjusted to allow for up to 25 people or 25% of rated occupancy at any confined indoor or outdoor space. And at this point, I would invite our Health Director, Pat Lopez, to come back to the podium to provide some additional information about changes planned for our directed health measure next month.
In addition to the changes related to the size of gatherings and occupancy limits, the new DHM, Directed Health Measure, will allow for non-contact team sports to begin June 1st and games to begin June 18. Contact sports like basketball, tackle football, soccer, and wrestling will not be allowed. No changes are being made to the measures related to child care facilities or restaurant capacity that exist in our community today. All indoor and outdoor locations or venues that hold 500 or more individuals will be required to submit a plan for reopening to our local health department staff for approval. The plan must contain the planned number of guests, how the location will meet social distancing requirements, and sanitation guidelines. We will continue to work with businesses and industry to assist them in making smart decisions about how to keep our community safe as we change some of our current restrictions. I encourage all community members to look at the COVID-19 risk dial to evaluate current conditions and take the necessary steps to protect themselves, their families, neighbors, and community. And I encourage businesses to use the business information presented yesterday on the dial to help guide decision-making.
Thank you, Director Lopez. As we continue to learn to live with this novel virus until a vaccine is developed, we will continue to prioritize the health and safety of our community while taking steps to address the economic crisis we are experiencing. In this pandemic, those priorities of ensuring both our public health and our economic recovery are interwoven. One cannot be achieved without the other. These most recent changes in directed health measures provide a framework for how we can continue to achieve both and successfully navigate through a new phase in the pandemic. Yet the individual actions of our community members will continue to be the key to limiting the spread of the virus. I was fortunate this afternoon to be part of a video conference call with mayors from across the country and with Dr. Anthony Fauci of the National Institutes of Health and the White House Coronavirus Task Force. And Dr. Fauci emphasized that to be safe, at a minimum, all of us need to wash our hands, to keep 6 feet distance from others, and to wear a face mask. We must continue to take care of one another, and these steps, hand washing, physical distancing, and face masks, are absolutely critical to doing just that. Moving on to our city operations update, we have some good news for all of you who may have stacks of borrowed library books that are threatening to take over your house. Lincoln City Libraries is offering drop-off Fridays from 10 a.m. to 5 p.m. tomorrow, Friday, May 22nd, and next Friday, May 29th. Containers will be located outside of all of the library sites except for the Williams branch. You will not need to leave your vehicles to drop off your materials, and staff will be available to assist if you need some help. No walk-up returns will be allowed, and the regular exterior book drops will be available once again, beginning June 1st. And I want to thank the Lincoln City Libraries for working with the health department to make this process safe. All library materials that are returned will be quarantined for 3 days before being checked in and used to fill wait lists. And all materials currently on loan, we just want to remind you, have a due date of July 1. And we would say that while our libraries do remain closed, our pickup service remains available. You may reserve materials online at lincolnlibraries.org or by phone at 402-441-8500. You will be notified when your materials are ready, and you'll receive pickup instructions at that point. And while regular on-site library programming has been canceled for now, our library team has been busy filling these requests, planning for the popular summer reading series, and preparing for another One Book, One Lincoln community reading experience. And you can find out more at lincolnlibraries.org, and I would just add for the media that our fearless librarian, head librarian Pat Leach, is also on the Zoom call if you have questions for her at the end of the briefing. And with that, we'll turn to some good news. May 28th is Give to Lincoln Day, and this year it's especially important that those in a position to financially support our local nonprofits do so. Our nonprofits are working around the clock to contribute to the care and support of our residents, as well as the spirit of this city, and they're doing so with much less operating revenue than they normally would have. Every donation you make from May 1st through May 28th in support of Give to Lincoln Day will be made bigger by matching funds provided by the Lincoln Community Foundation. The way it works is that each nonprofit that participates in Give to Lincoln Day will receive a proportional share of that $500,000 match fund based on its percentage of total dollars raised from our community members. A record total of 448 local nonprofits are participating in this year's event. And we encourage you to participate by going to Give to Lincoln Day by donating online to your favorite nonprofits at givetolincoln.com. All donations need to be made before 11:59 p.m. on May 28th to count toward the Giving Day and the Match Fund. And a big thanks to the Lincoln Community Foundation for organizing this event and for uniting the community around giving. It's needed now more than ever. So thank you for considering making a donation to Give to Lincoln Day. And finally, we want to remind everyone that the Lincoln Strong online concert series continues every Thursday night through Facebook. Tonight's lineup is Will Hutchinson at 6 and Andrea Von Kampen at 7. These concerts are a fundraiser for local musicians, bars, and restaurants, and this is just a great opportunity to enjoy wonderful local musicians and to support our local live music scene that has been hard hit by the pandemic but is resilient in its adaptation to online concerts. Again, that's the Lincoln Strong online concert series. Lincoln Strong is the Facebook handle. And with that, we'd like to open up to questions for the media, from the media.
Riley Johnson from the Journal-Star here.
Yeah.
Possibly a question for you, Mayor, or for Director Lopez. With respect to the DHM change and the plans that certain businesses will need to submit to the health department. Does the health department have say over whether those businesses will be able to sort of carry out their plans, sort of a veto power, or what's the authority there? And is it just a blessing of the health department, or is there enforcement if businesses were to have a larger crowd than the health department would think proper?
I'll just tee it up by saying that our health director does have broad powers during this public health emergency, but I'll let her come up and explain the details.
Riley, that's a great question. I really appreciate you asking that because it's an opportunity for me to share that many of our businesses already contact the health department, and we have really been working with them in partnership. Their concern is really how can they operate safely for those that they employ, and how can they have a safe operation for the public and still be able to provide a business and some economic inflow to them. And so we really haven't had an issue where we've had a problem. Businesses submit a plan. I think Kawasaki talked yesterday. They're one of the locations that we've worked with and provided them guidance on additional measures they could take to make things safer in the work environment for the employees. And we do the same with different venues that have been reaching out to us already about what to do, restaurants and other facilities as well. So we see it more as a measure of us assisting them and guiding them in the process. But of course, we're going to expect that wherever people are, bars, restaurants, other venues, that they follow the directed health measure guidance for the number of individuals that are allowed to be in the facility at that time.
And just add to that in addition to our health department's customer service focus and incredibly collaborative approach that they provide and that they receive from our local businesses, our conversations with business leaders have really been encouraging that folks are being cautious. They're taking the responsibility seriously. They care very much about their employees' safety, their customer safety, and that's very gratifying to see. We believe that working together, we can continue to move forward during this pandemic. Are there other questions?
Again, Riley with the Journal-Star. I had a question for Director Lopez. Somewhat in the data on the dashboard, Lincoln's community spread attributed cases are something like 87%. And in Douglas County, they're reporting closer to 42% attributed to community spread. And more, they're 55% of theirs are to direct contact. Do you know the distinction that they're seeing in Douglas County versus what we're seeing in Lancaster County? Is it just virtue of how pervasive our community spread is that you're having trouble linking direct contact cases? Or could you speak to that difference?
As we continue to investigate, we link cases together, and I just actually happened to be on a call with Dr. Poor from Omaha this morning, and I know they're working through some of their numbers. They've had a large influx related primarily to one industry, two industries, one being the long-term care and then the meat processing plants. So you'll see some variation in those numbers now, and they're working hard to reevaluate where that is today, and we'll probably see some change tomorrow.
Director Lopez, this is Bill with 1011. I was wondering your thoughts on the decreasing positivity rates and whether you are able to link that to anything in particular.
Well, I think, we've had more tests done, even though, as the mayor said, we continue to work towards getting lab results in a quicker fashion. But actually, it's due to more testing, and I think that We've been working hard with the Smithfield plant and those contacts too to mitigate and control the spread. But as you know, Bill, that can change, things can change overnight for us. But just looking at how we've been and this trend for the last week or so, I don't expect a major change.
Director Lopez, and with the Journal Star, before you leave the podium, with the new DHM, do you intend that the local DHM for June will mirror sort of the differences that were included in the most recent DHM, where some recommended guidance by the state was made mandatory by the health department?
I think, we're in the process, Riley, of re-examining our DHM. I think we can expect that some of those same requirements will remain, but in most areas will mirror the state DHM.
Just to follow up on your first question, Riley, of the two that you just asked, I think what would be probably helpful is to break out the cases by exposure type and acknowledge the known source, the cases with the different plants where we've had outbreak of a known source, because that is a big chunk of those community spread cases. So it's not the same kind of community spread, because we know where it's coming from and are very much, working with the business and the local health department that is the source, or working with the local business source. And that gives us some comfort level that community spread is more managed, because we are so focused on providing increased testing and working with direct contacts of people who are in the affected business. And most of the, many hundred or more of our direct contact cases are, of course, related to that as well.
So, Mayor, just to be clear, it would appear that those numbers that are on the city dashboard are a little bit dated. If you guys are able to identify the contacts or the cases that are tied to Smithfield or Smart Chicken, for example.
I wouldn't say they're dated, it's just the way they're presented. If you disaggregate the community spread numbers and show which ones are attributable to a known source that is affiliated with, for example, the Smithfield Crete plant, it's a significant chunk of those cases, as opposed to someone who might develop COVID-19 and who is a Lincoln or Lancaster County resident, but for whom we cannot find a source that is known to attribute their infection. Other questions? All right, well, with that, thank you so much for tuning in. Thank you for taking steps to protect yourself and your loved ones and your neighbors. We'll look forward to seeing you again tomorrow at 3:30.